is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength Conditioning Specialist, and co-founder of the Basketball Doctors, alongside with Dr. Gabe Ignacio. As the Basketball Doctors, our goal is to provide evidence-based information regarding all things basketball. This is all for educational purposes, not medical advice. If you need medical advice, please seek out a healthcare professional or send us a DM, see how we can help you. But let's jump into the topic about Osgood Schlatters. Did you know that 1 in 10 young athletes suffer from Osgood Schlatters? So Osgood Schlatters is this, sometimes you feel like there's a painful bump here, but this is a growth apophysitis, which is due to that bone growing faster than the muscles and the tendons. And over time, this quad muscle is pulling on this patellar tendon, which is gonna pull on this tibial tuberosity and cause that pain here in that, where people have that quote unquote excessive bump here coming up and they're below their kneecap. But the biggest thing with Osgood Schlatters is you'll see this with athletes around ages, especially for girls between ages 10 to 13, boys between 12 to 15. And how long does it last? This lasts for up to 4 years sometimes, but the typical timeline is anywhere between 12 to 18 months. And what puts the athletes at risk is that most of these athletes, like I mentioned before, they're having these growth pains and growth spurts where they're growing faster than the muscles and tendons. So what happens is this bone grows faster, and this pull, whenever you're playing in the active sports, that's why it's very common with basketball athletes, volleyball athletes, soccer players, anyone that has a lot of these eccentric and concentric contractions of the quad muscle, because this quad muscle is gonna cause this extension and then cause this pull when you're eccentrically loading on this little tibial tuberosity. That's gonna be putting you at risk for Osgood Schlatter. So anyone that has this recent growth spurt and plays, cutting or jumping sport puts you at risk. And if you're under the age of 15, puts you at risk for Osgood Schlatters. Another thing that we wanna go over with Osgood Schlatters is that this painful bump that goes here, you might see that bump sticking out a little bit more than your kneecap, and that sometimes may be there for years to come. I know we see some athletes with still that bump there, but it's not gonna be as painful. It's probably gonna be asymptomatic, meaning there's gonna be no pain at all. Because a lot of people ask us, like, does that bump go away? And usually sometimes it doesn't, depends on what goes on. But the biggest things on those is, what should you be doing for rehab? So a lot of people say, I should be completely resting it. My orthopedist says, don't do anything. And that's true to a certain extent. We want to rest up in the beginning, especially with those activities that cause pain. So like I mentioned before, basketball, soccer, volleyball, they all require these forceful quad contractions. So that's gonna be pulling, whenever you activate that quad, that's gonna be pulling here on the patellar tendon, which is gonna pull on the tibial tuberosity. Because as we mentioned, the quads here goes into the quad tendon, into the kneecap, patellar tendon, and the tibial tuberosity. And this is where you're gonna have that pain. But the biggest thing is you wanna be stretching out this quad muscle, because if you stretch out this quad muscle, that's gonna decrease the stress here in the quad tendon, which is gonna decrease the stress on that patellar tendon pulling on that tibial tuberosity. Also, you have to be strengthening the muscles in the back, the posterior muscles, the glutes, the calves, the hamstrings. That's gonna decrease the stress, excessive stress on the quad muscle, that's the reason why you're getting that pull on the Osgood Schlatters. Another question that I get is, how do I exactly know if I have it? Because there's different, how about jumper's knee versus patellofemoral pain syndrome? So if you have Osgood Schlatters, like we mentioned before, you're at risk if you're under the age of 15. If you play a jumping sport, it's probably gonna hurt here in the tibial tuberosity, and it's gonna hurt when you activate your quad. Jumper's knee, it's gonna hurt more in the tendon. Patellofemoral pain syndrome is gonna hurt more in the kneecap. So kneecap, patellofemoral pain syndrome, here in the patellar tendon, that's more jumper's knee. Here in the tibial tuberosity, even lower, that's Osgood Schlatters. So that's kind of like the quick little recap of, quick Osgood Schlatters 101. So I'll give you a quick recap again. This Osgood Schlatters, you're having this growth issue where you're growing fast, your bone's growing faster than your muscles and tendon, which is gonna cause a pull here whenever you activate the quads. That's why basketball players have it, because they're jumping, loading, pulling on this tendon, and that's gonna cause that bump to be painful and flared up. And sometimes what could be worst case scenario is you keep on pulling here, you don't rest, you don't strengthen the muscles, you don't stretch. That's gonna pull on this and sometimes lead to an avulsion fracture of the tibial tuberosity, which you require surgery to get back in there. So really kind of taking, rehab is really huge in this. So not only resting, but also strengthening the other muscles to decrease the stress of that quad tendon. So guys, if you guys like this video, please hit the like, subscribe button, and share this with your friends and families. And if you didn't like it, just let us know why you didn't like it, and then we'll try to fix that. But we are the basketball doctors. Let's ball for life.